In the first 2 weeks after surgery, limit your activities to essential functions, such as getting up to eat meals or use the bathroom and small walks. Don't overdo your exercises and activity. This can set you back and make for a longer recovery. It is important to increase your activity slowly so as not to have increased pain and anxiety. You can begin walking short distances around your home. When resting, make sure your leg is elevated above your heart with your leg straight. This will keep fluid from settling in your lower leg. Continue wearing your compression stockings you receive from the hospital as they help minimize swelling. To help manage your pain and swelling, apply ice or use an ice machine. Ice and elevation are a top priority in pain management and will minimize the amount of medication you need to take. Your discharge instructions will outline non-narcotic medications you should take. Prescribed pain medications are taken only if you need them. The goal is to decrease the amount and frequency of narcotics as soon as you are able, thus preventing side effects such as constipation, nausea, and dizziness. Continue any exercises or precautions you were provided in the hospital. Knee replacements usually start outpatient physical therapy within the week following surgery. In the weeks following your surgery, you may gradually transition from a walker to a cane, and then no device at all. One word of caution: don't be in a hurry to ditch the device. If you're in pain or limping, you should use a device to keep the stress off your back or other joints. Using a device earlier in the day when you are stiff or later in the day when you have pain, when walking outside your home or when navigating stairs, curbs, grass, or ice. It's important to reduce the risk of falling and injuring your new joint. A good rule of thumb is if you can walk without a limp or without pain, you can stop using the device. If you're not sure about something, refer to your discharge instructions or call the office to ask. Approximately 2 weeks after surgery, you will see the surgeon or advanced practice provider. At this appointment, they will check to make sure your incision is properly healing and answer any questions that you may have. Our goal at this visit is to assure you are walking without a limp, either with or without a walker or cane, and check your range of motion of your knee. After knee surgery, you will continue physical therapy to work on progressing your knee range of motion and strength according to how often and how long you and the therapist determine. Typically, after the 2-week visit, you will be seen 1 or 2 more times, depending on your progress. For total hip replacements, most patients do not need formal therapy, as walking is usually enough. Of course, if therapy is needed, your care team will discuss this with you. Before you know it, you will start to notice the gradual improvement in your quality of life. Remember, progress takes time. You should expect slow, steady improvement over the course of 12 months after your joint replacement. Welcome back to your life.